Okay, let's welcome our guests. Welcome to 2017 Subcommittee on Smoking Public Health Notice Amendment Order 2017 Deputation Hearing. I won't introduce the officials in attendance, so we have the Undersecretary and her colleagues. Our speakers will have 3 minutes, but since we do have a full house, we'll have to stop you at 3 minutes, and your speech is not covered by legislative powers and privileges, so you are accountable for what you say. We do have simultaneous interpreting. We have floor Cantonese English and Putonghua at your service, and our first speaker is Shatin District Councillor Mr. Lei Jiwei, and we also have Siksik Yun Social Service Mr. Ma Zhang. Siksik Yun serves the community through collective learning. We allow our students to learn social skills, communication skills, and we want to build a team spirit. We also build a positive outlook. So we believe that a smoke-free, safe, and health environment can allow youth to achieve balanced development, and therefore our community service group support the government's smoking policy, and we would like to see the health warning enlarged to the two largest services of packaging, 85% of the two largest services of the packaging. So adding the text warning and graphic image, it's not a new initiative. The Hong Kong government in 2007 had implemented this measure, and it was very effective. So not only did the public learn about the harmful effects of smoking, it also illustrated the damage smoking does to health. And now with the graphic health warning, the lower income bracket or even children understand the harmful effects of smoking. So the government is now legislating and wants to enlarge this graphic health warning so it will convey the message more effectively, and we want to prevent youth from smoking. We want to help smokers, especially the low income bracket, quit smoking, and this will be good for their health and for the overall economy. So the new health warning illustrates the quit smoking hotline. It can provide a greater opportunity or incentive for smokers to quit. So according to statistics, more and more jurisdictions are now enlarging the graphic health warning. So this is not only a global trend. I believe it also indicates that the process or it's effective. Therefore, Siksik Yun supports the government in enlarging the graphic health warning, and we would also like to see a regular change of the graphic health image. Thank you. Next, Mr. Liu Guisong. I am I've been in the tobacco industry for 20 plus years. I work in product packaging. I had counterfeit measures. I had been posted in different countries in Australia, in Asia, Malaysia, Australia, and I was responsible for changing the health warnings. Currently, my company, I'm in charge of inspecting counterfeit cigarettes, fake cigarettes. I also work with customs. I object to enlarging the health warning to 85% because fake cigarettes is proliferating. Fake cigarettes are proliferating if there's less area for counterfeit measures, it would be easier to produce fake cigarettes. Now, you might not be familiar with the Hong Kong situation. If you include parallel trading and fake cigarettes, it makes up 30%. It's the 5th largest in Asia. So tobacco companies spend a lot of resources every year, and I've heard in different venues officials saying that the Hong Kong only has a parallel trading problem. I don't know why the officials say that and what their assumptions. How do they come to that conclusion? As far as I know, customs in the past, whenever they caught smugglers, they would ask the tobacco companies to assess and to determine the percentage of counterfeit or fake cigarettes. But since January 2015, customs have not undertaken this procedure. So I would like legislators to help confirm this point. If the customs did not help determine the fake or counterfeit cigarettes, if we only have parallel trading and we don't have fake cigarettes, then that's why I object to enlarging the health warning to 85%. I thought you were done. Please continue. There are 2 points regarding the grace period of 6 months. First of all, I've worked in many other countries, and a lot of countries give 12-month grace period. In my paper, I have stated the different procedures that are needed. So if you really need to amend the law, it should be 12 months after the commencement date. So I want to also mention that the officials have only given us a portrait image. They haven't given us a landscape format image. So if we use that image, the image and text are distorted. So you should provide us with a landscape image. Next, the Auxiliary Medical Association, Professor Chen Jikao, Professor Johnny Chan. I support enlarging the graphic health warning to 85%, and also increasing the number of images from 6 to 12. So the graphic health image does not only help educate the next generation regarding the harmful effects of smoking, and it's a very useful channel. In the last 10 plus years, a lot of jurisdictions have been using graphic health warnings, and it clearly illustrates that the larger the image, the more effective it is on conveying the message of harmful effects of smoking. It also reduces the brand name effect, and at the same time it helps people quitting smoking and prevents young people from starting smoking. So a piece of legend, why should it drag on for 2 years and it's still not implemented? Hong Kong suffers more than 7,000 deaths per year due to smoking and secondhand smoke. So it's urgent that we need to move ahead. The tobacco industry, they claim that this amendment will leave less space for counterfeit measures. It will lead to proliferation of illegal cigarettes. But that has been proven incorrect or false in the global experience. The industry makes hundreds of millions of dollars. The counterfeit cigarettes is just an excuse. So enhancing the graphic health image will give them less area to advertise their product and affect their business. So I'd like you to understand that the purpose of the amendment is to enhance public health, and also we want to minimize health costs due to smoking. Currently, our expenditure every year is not less than 5.3 billion Hong Kong dollars. So I would like you to support this amendment as soon as possible. Next, Mr. Leung Hin Sing.
I am a fourth-year medical student at the University of Hong Kong, and I would like to express my alarm at the indifference of so many different members of society at the dire health consequences of smoking. I think we all know that passing this proposal would save countless lives and would alleviate the suffering of countless patients struggling with diseases like emphysema that are chronic and debilitating. Hong Kong has not moved forward in terms of cigarette packaging legislation since 2007. That's 10 years ago. In that time, other countries have either moved ahead or have plans to do so. They include countries like Nepal, like Vanuatu, like Thailand. Hong Kong is clearly behind the curve. And in fact, the proposal put forward by the government is already substantially weaker than the plain packaging requirements that were first implemented in Australia in 2012. Ladies and gentlemen, available evidence shows that larger pictorial warnings are effective at, number one, preventing new smokers from trying smoking, and in particular, these include younger people. And number two, in encouraging existing smokers to consider quitting. At this point, I'd like to address one of the myths put forward by the tobacco industry, which is that this proposal will inevitably fuel illicit trade and cause decreases in government revenue. I think available evidence from other countries, including Australia, the UK, and Belgium, have shown this to be otherwise. Industry representatives similarly claimed that banning tobacco from restaurants would hurt small business owners, put them out of business. This turned out to be false. So I think at this juncture, it's very important to recognize that even if there was some kind of decrease in tax revenue as a result of this proposal, there would be far more savings in terms of future healthcare expenditure. So I would like to urge all members of the Legislative Council and all government officials to support this proposal. Thank you.
Next one, Mr. Chow Hai Kit. Thank you. When we see our loved ones lose their health or even die from smoking, I can still remember how sad it was. My father allowed me to smoke at home when I was small, and I was playing around with the packaging, and I was showing off in front of my relatives and neighbors, saying that I was smoking branded cigarettes. And also when I was in junior secondary, when I passed by stores and newspaper stalls, I would be trying to see what cigarettes they sold. But then at that time, my father was already suffering from emphysema, and he said, don't ask me to quit smoking. That would mean that I would die. And in the end, in fact, he died from smoking. I also taught many senior secondary students who used to smoke. They would have been athletes, but then after smoking, they became so weak. Also, I passed by a convenience store, and I could see students gathering inside the convenience store, and they were looking at this light box containing cigarettes. They were talking about the different tastes of different brands of cigarettes. I'm a retired primary school headmaster. My mission in life is to allow young people to grow up healthily, and therefore I support that the health warning should be enlarged on cigarette packaging so parents and young people know more the harm of smoking. Curiosity is human nature. Young people are even more curious. You will see these very attractive cigarette packaging which would entice young people in trying out cigarettes. Many countries tell us from experience that if the cigarette packaging can become advertising for tobacco control, and if we can legislate to increase the coverage of the health warning, we have had evidence already to show that this will reduce the attractiveness of cigarettes to young people, and they will know more the risks of smoking, and they can even refuse to take the first cigarette. We must have health before one can live and learn happily. So, councillors, for the sake of our next generation, I urge members to support this proposal to increase the health warning to 85% as soon as possible, so that young people will not have their first cigarette. Next, Ms. Lau Yi Lok. I am a designer. I object to the proposal to include the nicotine and tar content on cigarette packaging. In January, in a special meeting of the Health Service Panel, I already pointed out that the proposal is problematic. First of all, the effectiveness of the message should depend on its content, not the size. Secondly, a health warning that is too large will deprive the consumer of his interest. And also, the indication of nicotine and tar content will be misleading to the public. But then the Health Bureau did not listen to us. You can look at the new health warnings. They are designed badly, and I believe the old designs are much better. If the government wants to change the content of the health warnings, the design work should be done by professional designers instead of just seeking to enlarge them. Would the graphic warnings really scare the public off? If that's the case, why do you still go for text? Why don't you just go for a textual message? And also, if the health warnings are too large, the anti-forgery features will not be able to be contained in the packaging, and that goes towards deprivation of the consumer's right. You should never have the health warnings covering more than 75% of the largest surface of the packaging. Next, Dr. Hong Chiu Fai. Or actually, we should have Mr. Ma Ka Chun from the Hong Kong Vape Association. Let us speak on the order. The Hong Kong Vape Association has been promoting different ways of smoking cessation to the public of Hong Kong, and we have also disseminated correct messages about electronic cigarettes to Hong Kong people. We also support the law to control tobacco. This time around, you are proposing to enlarge the health warning to 85%, and you are increasing the forms of health warnings from 6 to 12. But these only tackle the symptoms of the problem. We should, in fact, target the problem and not just work on the graphics. First of all, we have to understand why people smoke. One, peer influence. 2, influence of parents. 3, influence of advertisements. 4, the feeling of maturity. And 5, rebelliousness. Number 6, adventure and curiosity. And 7, self-abandonment. And 8, to feel more energetic. I'm sure people are influenced by people around them before they smoke. Therefore, we should first of all work on people who are around smokers. We should educate them. If these non-smokers who are around smokers will know more the harm of smoking, then they can influence the smokers to cease smoking. With regard to the indication of nicotine and tar content that would mislead the public, smokers would feel that, or will be misled to think that if they smoke 8 sticks of cigarettes with 0.1 milligram nicotine, that would equal to 1 stick with 0.8 milligram nicotine. Actually, the WHO already said that there should not be such an indication, so that consumers would not mistake that it is okay or healthy to take tobacco products with a low nicotine or tar content. In fact, what causes cancer? It is tar. And it is said that electronic cigarettes can help people cease smoking, and they are more effective than other products. How come we are not legislating to regulate electronic cigarettes? Why do you just turn a blind eye to this phenomenon? I hope the administration would also look at electronic cigarettes and not stifle its existence. I like to say Hong Kong Vape Association does not encourage people to speak, but to cease smoking. Next, Professor Lam from the Li Ka-shing Faculty of Medicine from the University of Hong Kong. I strongly support the proposal. The objection of people with vested interests cannot override health policies. The WHO has said that 1 in 2 smokers will experience premature death because of smoking. We should increase this kind of warning. Recent studies also show that if people start young and if you smoke a lot of cigarettes, 2 out of 3 would experience premature death. And there are 600,000 smokers in Hong Kong. At least half of them will be affected by diseases caused by smoking, and there will be economic losses resulting from it. Also, innocent people will be affected by secondary and tertiary smoke. Research in Hong Kong and other places also shows that if there is a larger graphic, there will be more education for the public. The most conservative estimate would tell us that even if 1% of smokers will quit, that means 6,000 people. So we can at least prevent 3,000 people from dying prematurely and also save them from many diseases. Our research and services show that the earlier people quit, the more effective it is. So we should not delay these measures, because if we delay, there will be more disabilities and deaths. Tobacco duty is also very effective. If we can do the both together, there will be a big effect. The Hong Kong Council on Smoking and Health and also our own research show that the health warning are already effective, and also the tobacco duty is also effective. And in fact, most smokers support the enlarging of the graphic. Many people amongst the public do not understand the harm of smoking. If there is a larger graphic, they will become more alert, and non-smokers will then also walk away from secondary smoke and help their relatives and friends to quit smoking. There is a ban on advertising, but the industry is making use of loopholes in the law, and they are mounting advertisements at vending points. Most of the people in Hong Kong think that these amount to advertisements, and this will entice people to smoke. If there is a larger graphic, it can help to minimize the influence of advertising. Young people are gullible, and they may be attracted by the packaging. If there is a larger graphic, it will prevent them from smoking. And to smoking parents and relatives, the young people can then help them. We'll continue with our research, and we will assess the effectiveness of the new order. We'll also do our best to help smokers quit. We hope the administration can mount more publicity and extend your services and also implement this order ASAP. Next, Mr. Leung Chin Ching. I am a social work student of Hong Kong U. I'm also a counselor for young people who smoke. In my work, I can see that young people would embrace this feeling of relaxation after smoking in nicotine, and they seek to disregard the harm of smoking. I also do tests of carbon monoxide on tertiary students. Those who smoke have a 10 times content more than other people, so they have worse pulmonary function. They will start to gasp for air after walking up some steps, and I would say, therefore, that we should do more with cigarette packaging. In 2007, the administration adopted 6 health warnings and said that they should at least cover 50% of the cigarette packs. It was a deterrent at first, but then we have had them for 10 years, and only Hong Kong has not updated its health warnings amongst Asian countries. That is why we are having a slowing trend. We have over 640,000 smokers who are over 15. We should continue to update the graphics. In fact, that has always been an effective and important tool in helping smokers. In fact, many young people were aware of the warning at the beginning, but then they have been looking at the same packaging for 10 years and they have become numb and they just don't see anything anymore. In fact, we can also include messages like loss of memory, early death of infants, and all these will relate to young people. But these thoughts don't come to their mind when they smoke. But we can include them on cigarette packaging. So I agree that there should be 12, and also they should cover 85% of the largest surface. So young people can see these warnings and come to understand the harm of smoking. And you can also include the message that half of the smokers die prematurely, and you should also print the quit line. This will help protect public health, and so young people in Hong Kong can grow up healthily and achieve their ideals. This is part of the community education that we need. Right, thank you. Next, the chairman of the Hong Kong Eastern District Parent-Teacher Association. We support this order. Since smoking is so bad for health, the administration is proposing to legislate the smoking order so that the graphic warning will be expanded to cover 85% of the packaging. And also there would be 12 forms of health warnings, and the quit line will also be printed. We definitely support all these measures because smoking is harmful to health. It is a well-known and well-supported fact. As parents, we of course worry that our children might take to smoking, and so they would suffer from the harm of smoking. If there is a quit line printed, and also if there are 12 warnings instead of 6, we believe this will help the public understand the evils of smoking. And for smokers and who are new to the habit, that will serve as a warning. And there are young people, you know, they may think that it is trendy, it is the thing to do. And if you have a larger graphic, I'm sure it will act as a deterrent, and the industry will not be able to use the packaging of cigarettes as advertisements. The quit line will be an important message. According to the Hong Kong Council on Smoking and Health, which asked the Hong Kong Youth to do a research in 2016, it shows that 72% of interviewees agreed that the graphic warning should be extended to 85%, and 80% of the interviewers said that there should be stronger warnings, and 70% said that there should be frequent replacement of the contents, and about 80% support that the warning should cover 100% of the packaging. Half of the smokers, in fact, also support these measures. And if we can look at other countries, we can see that if we enlarge the graphic warning, it is an effective tool in lowering the smoking rate. In 2012, Australia became the first one that allowed 100% coverage, and there was a drastic drop in the rate of smoking. UK, France, and other countries also go for 100% graphic warning. And I believe Hong Kong can follow suit. In order to protect public health and public interest, we hope the Council can support the amendment order as soon as possible, so parents and the public can walk away from the harmful evils of smoking. Dr. Ho Ka Yen? It is an undisputable fact that smoking is bad for health. According to the WHO, half of the smokers will experience premature deaths, meaning 1 in 2 will die an early death. Research also shows that if one starts early and if one is a heavy smoker, 2 out of 3 will die from smoking. Tobacco packaging is the most direct tool to publicize the evils of smoking, and a graphic, a picture paints 1,000 words. So the WHO is encouraging countries to go for 100% graphic before 2018, or at least to enlarge it to 85%. Australia, the UK, France, Hungary, and Ireland have already adopted the measure. But Hong Kong introduced the graphic warnings in 2007, but there has been no adjustment over the last decade. So we ranked 72 in terms of graphic warnings, and we are lagging behind less developed places. The Hong Kong Council on Smoking and Health commissioned the Public Health College of Hong Kong U to do some research, and they interviewed 2,058 persons at random on telephone, and 80% of interviewers supported stronger health warnings, and 72 said that they should be expanded to 85%.
呢一個擴大煙害圖像警示嘅議題上，已經取得一定嘅共識。作為一名醫護人員，促進公眾健康係我責無旁貸嘅責任。因此，我哋代表香港大學女性戒煙熱線，強烈要求立法會。
That's why I urge legislation as soon as possible and enlarging the graphic warning to 85%, and the number of prescribed forms should be increased from 6 to 12. And the quit line 1833183 should be printed on the packs as well to enhance public awareness and reduce the smoking rate. And next, Ms. Mohoy Yan from the School of Public Health, the University of Hong Kong. The school strongly supports the captioned amendments on increasing the size of health warnings and increasing the number of graphic health warnings. We found that 70% of adolescents in Hong Kong saw tobacco product displays in retail stores in the past 7 days. 20% of children and adolescents saw their parents' cigarette packets at home in the past 3 months. Since children and adolescents are frequently exposed to cigarette packs, Koch has commissioned HKU SPH to conduct a focus group study among primary and secondary school students on their perceptions towards cigarette packs from February to March this year. Apart from the 50% coverage of graphic warnings, we also propose 85% or 100%, in other words, plain packaging. And the findings are as follows. First, when given the 85% warning packets, students would pay attention to the health warnings, but students would pay attention to the brand logos when given the 50% warning packets. 2. The 85% warning packets would increase awareness among children on the harms of smoking, and plain packets with 100% health warnings would have more deterrent effect. These show that enlarging the health warnings from 50 to 85% with the aim to further expanding them to 100% in the future. These amendments will likely have the following effects. 1. Smokers will be more aware of the harms of smoking. And 2. Children with smoking parents will find smoking less attractive. And 3. Smoke-free social norms will be enhanced. And 4. Use of the quit line would be enhanced. And finally, tobacco use and smoking prevalence will decrease. Finally, on behalf of the School of Public Health of HKU, I urge all legislators to take heed of our advice and place an emphasis on public health and support the enlargement of health warnings on tobacco packets. Next, Mr. Chen Man from Pok Oi Hospital. The Pok Oi Hospital strongly supports the recommendations of the government on the health warnings of tobacco products under the order, including 1. The area of graphic health warnings should cover at least 85% of the 2 largest surfaces on the packs or retail containers to reduce the appeal of such products, and 2. Increasing the number of prescribed forms from 6 to 12 to achieve higher deterrent effect, and 3. The bilingual warnings on the cigarette packs should include the quit line to encourage smokers to quit smoking. Currently, Pok Hospital offers free Chinese medicine and acupuncture cessation services to cover more than 100 service locations all through Hong Kong in order to encourage smokers to quit smoking. Since the services were offered, more than 8,000 smokers benefited, and more than 65,000 people have benefited from the free Chinese medicine and acupuncture services. When offering the services, we realized that most smokers smoked for the first time because they are attracted by the tobacco packaging and marketing. And some smokers only realize that they are being misled when they see health issues. That's why we urge LegCo to pay attention to public health and support and pass the recommendations of the government on the amendments to the health warnings on tobacco products. Next, Ms. Lim Ka-wai. I'm a doctorate student. Smoking is extremely harmful to health. According to academic materials, the rate for mature death is 50%. For every 2 smokers, 1 is killed by tobacco. And according to a latest study, for people who smoke heavily since young, for every 3 persons, 1 would die from smoking. Smoking has many harms. It can lead to multiple cancers. According to the Cancer Research Center in Hong Kong, according to 2014, lung cancer ranked 2nd among the 10 major cancers. And according to the Department of Health figures in 2007, and chronic tuberculosis is the 5th killer in Hong Kong, and there are many reasons for the disease. Smoking and exposure to secondhand smoke are among the factors. These would lead to discomfort or even death, and they lead to a heavy burden on our healthcare system. Cigarette packs are a direct channel for smokers to be exposed to tobacco. Compared to Europe, US, and Australia on the 100% coverage requirement, Hong Kong is really lagging behind. That's why the WHO urges countries to adopt 100% graphic warnings on cigarette packaging. This way, tobacco companies cannot use attractive packaging to mislead young people. In Europe, US, and many countries have adopted 100% graphic warnings. Hong Kong is really lagging behind. In Hong Kong, we only have 6 prescribed forms on cigarette packs, and the coverage is only 85% of the total area, so there's a lack of deterrent effect. As a nursing doctorate student and healthcare professional, I urge the legislation to be passed as soon as possible to enlarge the graphic warnings to at least 85% and increasing the number of prescribed forms to 12, and adding the phrase or warning, half the smokers lose their lives because of tobacco, as well as the quit line 1833183, so that young people would know the harms of smoking to their health. Thank you very much. Next, from the Hong Kong Society for Nursing Education Limited, Dr. Chung Oi Kwon. Good afternoon. I represent the Society. We support the 2017 Smoking Public Health Notices Amendment Order. The ratio of premature death among smokers is 50%, so for every 2 smokers, 1 would be killed by tobacco. For young smokers or heavy smokers, for every 3 smokers, 2 would die from smoking. Tobacco contains a lot of harmful substances, including tar, nicotine, etc. and these would increase the risk to different diseases, including lethal cancers, pulmonary diseases, respiratory diseases, and reproductive system diseases, etc. And the chance of contracting lung cancer is 10 times higher than non-smokers. We feel obliged to enhance awareness. The WHO supports 100% graphic warnings, and they urge the adoption of full graphic warnings or enlarging the graphic health warnings to at least 85%. Many countries, including Australia, UK, France, and Ireland, have adopted these measures. Hong Kong is a metropolitan city. It's also very crowded. So on behalf of the Hong Kong Society for Nursing Education, we urge the government to catch up with global trends and enlarge the graphic warnings to 85% and increasing the number of forms to 12. And they should also incorporate the quit line on cigarette packs to enhance public awareness and prevents tobacco companies from promoting their products through packaging. This would protect the public from the harms of tobacco and secondhand smoke, and we can also alleviate the burden on our healthcare system. Next, Ms. Chang Tan. Thank you. I support enlarging the graphic health warnings to 85% and increasing the number of forms from 6 to 12. We should also incorporate the quit line on cigarette packs. In Hong Kong, since 2007, the requirements of the graphics have not been updated, so the deterrent effect has been eroded. And the graphic warnings only make up 85% of the packaging, so there's a need to enlarge the graphic warnings. For other countries, for example, India and Thailand, they enlarged the graphic warnings to 85%, and in Australia, in 2012, they became the first country to adopt 100% health warnings. So you can see that this is becoming a trend in tobacco control. As one of the pioneers for embracing graphic health warning in terms of global ranking, we have fallen to about 70. We are doing even worse than countries like Laos and Sri Lanka. In 2016, the WHO has adopted 100% graphic warnings as the theme for the World Smoke-Free Day, and we urge the government to enlarge the graphic warnings to 85%. So it's inevitable to enlarge the graphic warnings, and there's no ground for compromise. According to statistics, after enlarging the graphic warnings, different countries have achieved positive results, and smoking rates have dropped. We can see that these measures can encourage people to quit, and we can stop young people from starting. According to a recent study, for every 3 persons who smoked since youth, 1 would die prematurely. Young people are our future, so we are obliged to take out the relevant measures to safeguard youth health. And in 2015, the government suggested enlarging the graphic health warnings to 85% and increasing the number of prescribed forms from 6 to 12. We hope LegCo can implement these measures as soon as possible to safeguard public health. Next, from the Joint Council of Parent-Teacher Associations of the Sha Tin District, Mr. Chen Puyi. Smoking is harmful to health. This is obvious to everyone. As a representative of parents, parents should protect our children from the harms of smoking. The government has not made major changes for many years. We would certainly support this amendment. We are going to enlarge the graphic warnings to 85%, and we strongly support the proposal. By enlarging the graphic warnings, tobacco companies would not be able to attract new smokers through attractive packaging. We had a discussion on this, and some parents even advocated 100%. Some deputations talked about the difficulties in featuring counterfeit functions. Just look at our banknotes. They have very complicated designs, but counterfeit features could still be incorporated. We have seen successful cases overseas. Hong Kong has been falling out in the past, so why don't we learn from others as well for in this case? As a parent, a lot of deputations have talked about the academic or medical side of the issue. Now, we would like to tell the government that parents fully support the government's work in tobacco control. I'd like to share my personal experience. My father was a smoker when I was 20. He died from lung cancer. So this is a prime example. I think if we do not do more to fight smoking and decrease the number of smokers, I think we will see more and more examples in the future. Thank you. Ms. Ho Long Kwan, thank you. I support amendments to the graphic warnings on cigarette packs. Hong Kong has been the forefront in Asia as one of the early adopters of graphic warnings on cigarette packs, but over the past 10 years or so, no amendments have been made. Of the 12 countries in 2007 which adopted the measure in 2007, Hong Kong is the only country which has not enlarged the graphic warnings. So even though Hong Kong was one of the earliest countries to adopt graphic warnings on cigarette packs, we are now lagging behind. Right now, the graphic warnings only make up 50% on cigarette packs, and we only have 6 prescribed forms since 2007. Other countries have enlarged the health warnings, for example, Uruguay, Thailand, or Nepal. They have already expanded the graphic warnings to 80% or more. Australia even became the first country to adopt 100% graphic warnings. And the smoking rate has plunged. So Hong Kong has to amend the graphic warnings. And in 2015, the government had suggested expanding the size of graphic warnings to 85% on both sides of the packs, and the number of forms will increase from 6 to 12, and to incorporate the quit line 1833, 183 on the packs. Despite support from the majority of the public, there were a lot of challenges, especially from tobacco companies. Most of them questioned the effectiveness of such moves. According to the International Tobacco Control assessment, the larger the graphic warnings on cigarette packs, the more effective the deterrent effect. By enlarging the graphic warnings, we can catch the attention of smokers and enhance the deterrent effect, and they would be more motivated to quit. That's why I find the objections completely ungrounded. I urge the LegCo to pass the amendments as soon as possible, because the warnings would encourage the public to quit and discourage young people from picking up the habit. Public health should be our priority, so we should safeguard their health above the interests of tobacco companies. And Mr. McQuaffong from Quaffong Consulting and Training Company Limited. I think this is a waste of taxpayers' money. As a responsible government or LegCo, why don't you support this helpful proposal? I think only tobacco companies would stand in the way. They want to continue to control young people or chronic smokers. They came up with a lot of unreasonable excuses. I did not follow the discussions from the previous session. I think most deputations support this amendment. Tobacco companies have resorted to a lot of excuses and absurd reasons to deem this amendment useless, and that it would lead to rampant illicit cigarettes.
Some people also say 85% has no impact. It won't have any impact on new smokers and old smokers. All that is absurd. I'd like the tobacco industry and other sympathizers, that is smokers, you shouldn't drag your feet and you shouldn't attract young people, because smoking is not trendy in Hong Kong. If you look at the old smokers, why can't they quit? Well, a lot of them are sick, they died early, and before they died, they were in pain, they have cancer, they have to rely on oxygen masks, they need painkillers, they're on morphine, it affects the quality of life. So we don't need to waste precious Hong Kong medical resources. Members, chairman, especially you're an experienced doctor. You should lead the other legislators and immediately support this amendment. Hong Kong only has a 10% of a smoking population. There is a benefit for you to support this amendment. I think 90% or more of voters don't support smoking. And legislators, have you witnessed hospital authority, internal medicine, the occupancy rate is more than 100%. And a lot of times it's because of smoking, and people are hospitalized. So I would like you to endorse this as soon as possible. Next, Mr. Zhang Lu Fei.
Specializing in public health, and we strongly support the government's proposal to amend health warnings on tobacco product packets and retail containers. I'm not going to reiterate all the scientific studies that show very clearly that pictorial warning labels are effective. I'd like to stress that these health warnings need to be updated, refreshed, and made bigger. This is because warning labels lose some of their effects over time, and Hong Kong has done hardly little for the past 10 years. The proposals are urgent steps to upgrade protection against harm of tobacco. Many countries have already implemented the WHO recommendations. Hong Kong is lagging behind, and we are in danger of surrendering our achievements in tobacco control. For many years, the LegCo has acted wisely to enact laws that protected Hong Kong from the dangers of tobacco. The present proposal is a logical, even a small step forward. I appeal to the councillors here to put people's health interests above all else and pass this piece of legislation as soon as possible. Thank you.
唔該晒，下一位係香港
Mr. 朱國能。Ladies and gentlemen, smoking endangers health. It's like saying mom is a woman. We don't need it's redundant. We don't need to reiterate the dangers of smoking. The focus is on 80% graphic warning and what outcomes it will have on the smoking control. Well, we need to be practical. Policy has to be implemented. We should not just spout hot air. It's pointless to say that the mother is a woman. I can tell you, if smokers have smoked more than 5 years, it's very difficult for them to quit, and that means the success rate will not be more than 30%. If they smoke more than 20 years, the success rate is less than 5%. So we want to be practical, and if you are asking a chronic smoker if you want them to quit because of a graphic health warning, isn't that a bit naive? Isn't that just surrealism? So relying on a graphic warning, using a graphic warning to achieve a smoking policy to reduce the smoking population, if that were logically sound, then I would suggest that the graphic warning should be increased to 95%, not 85%. 85% is not enough. Make it 98%, even better. So just now we heard the larger the warning, we'll have less smokers. So make it 98%. You'll reach your goal even quicker. So just now I also heard some ridiculous theories. That is, packaging entices smokers or young people to smoke because the packaging, the advertisement is attractive. Well, but that's not the case. It's peer pressure. They want to belong to a group. Maybe they are depressed. They are underachieving. They are not social. They might have emotional relationship problems. That is the reason they take their first puff. It's not because they are attracted by the packaging. I'm surprised. Why don't we spend money on education, on health education? Health education should be a mandatory course. Okay, Mr. Chu, time's up. Next we have from Hang Feng Tobacco Company, Mr. Lim Shengwa. Well, as a tobacco distributor, our biggest concern is the amendment. During its scrutiny in LegCo, before there is commenced, there's still a chance for it to be amended or repealed. So if they complete the scrutiny by middle of June, then the tobacco manufacturer has to implement a new health warning, and it has to update the health images from 6 to 12. We have to test print quality. We have to arrange for overseas manufacturers. We have to work with distributors, retailers, and we cannot complete all the work within 12 months. And of course, speaking as the industry participant, as a distributor, we will run across a supply shortage, and it'll lead to a loss. The government and even the public might not be able to consider the market needs and logistic needs. So our company suggests that the grace period should be 12 months after the commencement date of the bill. So we support an orderly progression to controlling smoking, but the drafting of policy should balance different needs, and you should also consider the legislative impact. A lot of times the government relies on overseas studies, but they neglect or ignore the local consumer behavior or industry needs. So smokers are aware of the risks to smoking, and I think everybody is aware of this in high school and university. So, enlarging the health warning and its efficacy on smoking. So, in the lack of, given the lack of scientific evidence, it's counterintuitive, and it actually leads to a heavy burden for distributors and the tobacco industry. Next, we have a Hong Kong professional, the chairman, Mr. Chen Ginke. Hong Kong is now facing a big public health threat, and in 2 chronic smokers, 1 will die early, prematurely, and WHO estimates that every year 6 million people lose their life because of tobacco, and by 2013 the figure was 8 million according to Hong Kong Youth Study. Smoking leads to about 7,000 deaths in Hong Kong, and the economic loss is 5.3 billion. So the Hong Kong Professional Association supports the Hong Kong government to strengthen its smoking policy and increase the health warning to 85%. And we want to reduce the number of smokers in Hong Kong, and we want the society to be more healthy. We want to minimize the economic loss. And so after all these efforts, the number of smokers is falling. From the 80s, it was 23%, and it's now at 10%. We now estimate that there are 640,000 smokers. It's a record low, and we now have a number of smokers under the age of 19 that dropped from 3.8% to 2%. But we see that the number of male smokers are still 18%. That is, out of every 5 people, there's 1 smoker, and for females, it's 3.2%, and that has gone up by 0.1% compared to 2012. We think that smoking policy is now at a bottleneck. So, according to the Census and Statistics, 63% of respondents, smokers, said they never tried to quit and have no intention to quit, and in 10 years' time, they smoke 14 cigarettes, and the future, the road to quitting is long and arduous, so we need a series of more stringent measures to help people to quit. So, proceeding step by step and enhancing the law is the government's responsibility. So the graphic health warning and packaging, the last time it was changed was 10 years ago. So increasing the area is reasonable. So we not only have healthcare professionals support, different professionals also support the government's proposal. We feel that tobacco packaging, health warning, increasing it to 85% of the 2 surfaces, and increasing the text warning and and making the graphic image more scary is effective. We feel that this amendment had been discussed for 2 years, and it's not controversial in society. It doesn't lead to a heavy social cost, but on the other hand, it can enhance public health. So I hope legislators can do a better job for the public health. Otherwise, the Hong Kong public will suffer. Okay, thank you. Next, we have Mr. Wang Saizang. I'm not a tobacco industrialist. I don't like to smoke, but I feel that the government's proposal is pseudoscience. If you compare the number of adult smokers, Japan has a much lax policy. The Japanese cigarette packaging doesn't have these graphic health warning. And the adult average consumption is 1,700 sticks of cigarettes. If you look at Czechoslovakia, Greece, and Luxembourg, the EU countries, it is stricter than Hong Kong. That is acknowledged. But you look at Belgium, 2,300 sticks. Czechoslovakia, 2,900 sticks. Greece, 86. Luxembourg, 2,883 sticks of cigarettes. I would like those who support the government give us real statistics to prove that this packaging can really control or have an impact on smoking. Forget 85%. Even if you go to the Japanese staff, and there's no problem, because Japan smoking policy, it doesn't focus on packaging. This packaging policy, it's just to answer to WHO. It's Margaret Chan is traveling first class, and she hasn't done anything. Her travel expenses are even larger than the budget on AIDS, and I think you're just wasting time. Okay. Another issue is some WHO policies should be complied with. For example, tar and nicotine levels. You shouldn't list that. You should just scrap it. Why do you still have it? That is misleading. Some people think that tar or nicotine is lower. It's even safer. I don't understand why the government doesn't eliminate all the tar and nicotine content levels. I suspect the Undersecretary, Ms. Chan Xiuqi, is trying to pull the wool over our eyes. This subsidiary legislation, and it's going to be the procedure is negative vetting. So if you're going to comply with WHO, you have to provide us with statistics for the public. I don't see these statistics. Why do we have to waste public time to do this work? If you want to control smoking with the young people, just do what Japan is doing. They have to register ID to purchase cigarettes. Why don't you do that? Okay, I'm done. Next. Mr. Liu Zhongsun, Yunting, District Councillor, has to convene a meeting, and I am representing Councillor Yunting. Yunting is concerned about public health, public education, and wants to reduce the consumption of tobacco products. So, from the perspective of public health, we feel that we need to immediately increase the graphic health warning. Second-hand smoke, third-hand smoke has an impact on health. We've heard that on numerous occasions. What I want to talk about today is the graphic health warning, the importance of it. There are studies indicating that the graphic health warning can have an impact on the attractiveness and of tobacco. So by enlarging the area, it can enhance our awareness, and also it can prevent the young people from taking the first puff. So the government has suggested that the graphic health warning be increased to 85% of two surfaces, but that is behind international practice. We know that in Australia, 100% can help prevent young people from taking the first puff. In Canada, Uruguay, Thailand, UK, we have also other successful experiences that having 100% graphic warning has helps convey the message. The media and the government have stated these findings on numerous occasions. Kosh has indicated that 70% of respondents support the 85% graphic health warning, and 80% support 100% graphic health warning. So we feel that the government, being responsible for public health, it's necessary for the government to promote 100% graphic health warning. 85%, you can say, we can just only accept that reluctantly. The 6 graphic images have been used since 2007. Councillor Yunting had conducted a survey, and the council had found that the smokers are desensitized to these old images, and we feel that having new images is very effective. We don't know when and which smoker will inspect these graphic images, but we need to use the largest surface area to display these graphic images, and maybe it will work with one smoker at a time. We need to implement this as soon as possible. Next. Guntong. Parent-Teacher Association, Mr. Hai Bing Chong. Chairman, as a parent, I want to say I don't need experts and doctors to quote statistics. Put it very simply, everybody knows that smoking is harmful. Even smokers, if you ask them, do you think they would allow their kids to smoke? They are chronic smokers and they won't give their children cigarettes. We know that it's harmful to children. So I want to say that whatever the tobacco industrial say about the graphic health warnings are ineffective or they have problems with counterfeiting, but as a parent, if you ask me, increasing to 85%, I feel that is important. Hong Kong being a healthy city, I can't see why such a healthy city we allow such unhealthy products. The only explanation is that it's a big business. We know that the business, it's beyond a description. We have a lot of physical activities where they have tobacco advertising, and if you want to be a healthy city,
容許佢做呢樣嘢係當然可以講有稅收，但係大家都明白。
Of course, there is tobacco duty, but you must understand that our health is affected and our medical costs will escalate. The medical costs will outweigh the tobacco duty you are receiving. So as long as there is any measure that can help one person smoke or not starting to smoke, we should adopt it. I agree that it is difficult for those who have 5 years, 10 years smoking experience to quit, but we must keep our children away from tobacco. If there is anything we can do at all. I am not a smoker, but I can tell you that my father and my uncle both smoked, and one died from pharyngeal cancer, the other one from lung cancer. I don't know whether you have seen them. They have this opening in the throat because they can't breathe. I saw how my uncle suffered. That is why I never smoked. However, young people are smoking. They think it's good for their image. You will see that in films, in TV dramas, you see fewer people smoke. This is because they don't want to influence young people. Everybody knows smoking is no good. So we should in fact have a smoking ban. Some people say non-smoking public areas will affect their business, but look at what is happening. I in fact would like to see a country where smoking is totally banned. Thank you. Next, Mr. Chu Kwok Wah. Chairman, good afternoon. I'm a smoker. It seems I need so much bravery to speak up here because everybody is speaking on this issue. Just like to ask a question, Ms. Sophia Chan. Why do you want to enlarge the warning to 85%? Why do you say it can immediately dampen people's desire to smoke? Have you asked smokers what is important to them? Smokers just want to know whether the cigarette is real or fake. They don't mind the warnings. Some people say the warnings will prevent people from taking the first cigarette. Well, the motive to smoke is not from the packaging. It is not from the tobacco packaging that influences people to smoke or quit. In fact, there is a lot of research on the psychology of smokers. Say they are seeking some kind of compensation, and it also helps people relax, etc. We are arguing that if you tell me 85% is effective, then why don't you go all the way to 100%? We don't mind. Smokers are not going to give up smoking. Your tobacco control policy should do everything to help smokers. I remember a few years ago when I smoked next to a dustbin, I saw this sticker containing your slogan, and then it says quitting smoking would be good for your family. And then I thought, if I don't smoke to start with, how can I quit so that I do something good to my family? That slogan goes to show that when your TCO or Department of Health think about slogans, you are not starting from our angle. It seems you are just completing your job. Okay, it has been 10 years. Let's increase it to 12. If it is too small, let us increase it to 85%. I know why you don't want to go all the way, because you will have nothing else to do in the next stage, because you can't increase it to 120%. So to me, you give me the impression that you are just trying to do your job. In fact, your publicity can be three-dimensional. Somebody mentioned Japan. I won't repeat it. The Japanese publicity is multidimensional, but in Hong Kong, remember you banned the poster showing Audrey Hepburn smoking a cigarette. You're really like an ostrich. You bury your head in the sand. Just now, somebody said we can help members decide by the number of votes, but that is not good. Mr. Chu Pak Hua, I am a smoker as well. I have heard many statistics just now. Well, is it that you think that smoking is so evil? To me, your order will not make any difference unless you want people with poor eyesight to see the warning. If you want young people to stay away from smoking, if you want people to quit, well, the warning is not going to help. You should let smokers know what smoking is all about. You should not just try to cover up what smoking is all about. Thank you. Next, the British American Tobacco Company, Hong Kong Limited.
Chairman, my name is Dominic Geyser. I'm a partner of Herbert Smith Freehills, and I appear as advocate on behalf of British American Tobacco Hong Kong. BAT firmly objects to the government's proposal contained in the relevant amendment order on the basis that it's inherently flawed and problematic. The amendment order is unconstitutional because it breaches Articles 6 and 105 of the Basic Law. Further, the order is disproportionate in that there is no social benefit to it. Smoking prevalence in Hong Kong is nearly the lowest in the world at 10.5%. 85% graphic warnings are simply not necessary and unreasonable in the circumstances. The evidence relied on by the government in support of the proposed 85% warnings is in fact unsupported. In addition, the Secretary for Food and Health has acted ultra vires in that he does not have any power to prescribe health warnings which curtail trademarks, legitimate property rights owned and used by BAT in the ordinary conduct of its business. The amendment order is therefore unlawful. BAT has raised all of these issues in great detail with the government since June 2015, but has not received any substantive response, despite a written promise of the same, other than a recent two-page letter which refers back to prior Legislative Council papers and meetings. The issues raised by BAT cannot be left unaddressed or ignored in circumstances where the effect of the amendment order would clearly infringe constitutionally protected fundamental rights. The position is even more unsatisfactory given that the government has all along refused to conduct a formal public consultation before formulating its proposal. And this is inconsistent with international standards in other countries, including Australia, the UK, New Zealand and Canada. And this is very important because there is indeed public opposition to the new graphic warnings. As to the adaptation period contained in the amendment order, this is entirely insufficient. The Secretary made a prior commitment to provide 12 months at the 20 March 2017 Panel on Health Services meeting, but the true adaptation period is only 6 months. While this only begins in October of this year, the period since Gazette in April is not a true adaptation period, as BAT cannot begin to implement the changes until the amendment order passes scrutiny through LegCo. The overall period will accordingly be much shorter than 12 months, which is inadequate and unfair to BAT as it carries significant commercial ramifications. BAT considers a true 12-month adaptation period after the commencement date to be a substantive legitimate expectation which the Secretary has breached. In closing, BAT urges this subcommittee to properly scrutinise this amendment order in light of the very serious concerns raised by BAT and others who oppose it, as well as the government's failure to take these concerns on board. Thank you.
好，唔該。下一位係基督
Thank you. Next, United Christian Nathasol Community Health Service. Now, Mr. Lau Chi Chang. Thank you, Chair. United Christian Nathasol Community Health Service, Tin Shui Wai Center, provides cessation service for new arrivals in Hong Kong. We strongly support the increase of the coverage to 85%. And also the increase of forms from 6 to 12, and they should be regularly updated. Also, there should be the quit line for the following reasons. Number one, clinical direct experience tells us that 30-odd years old male smokers might have smoked for 5 to 6 years, and they are already very weak. And also, we have seen 70 years old men coughing incessantly. They had so much phlegm they could not sleep. This is not what we want to see, because these people are affected by the evils of smoking. The Hong Kong U Public Health College also did a survey on the proposed policy. It is shown that health warnings are really a reminder to people who smoke, and this will help them to seek cessation help. And number three, the warnings would have a positive influence on smokers, and they can also have a preventive effect. In doing our outreach work, we saw a South Asian boy of 12. He was affected by his peers. He did not know the evils of smoking. He just felt that he could choose to smoke, but he knew nothing about nicotine, and public education did not reach him. And therefore, if there is a health warning on the cigarette packaging, it will impress upon them, so they could resist peer influence. Apart from the warning, I hope there will be a basket of other factors, for example, enlarging no smoking areas and also increasing tobacco duty. Compared to Western countries, Hong Kong is not achieving the WHO requirement of 70%. Also, from my frontline experience, I can see that smokers are paying over $50 for one pack of cigarettes. I think by increasing the tobacco duty, it will be a bigger deterrent, because it's going to be very expensive. I hope members will support the order. Okay, your time is up. Next, the New Voice Club of Hong Kong, Mr. Tang. I represent the New Voice Club of Hong Kong. We support the health warning on cigarette packs. I'm a smoker. I was found to be affected by pharyngeal cancer last year. I joined the New Voice Club. I am using an electronic mic to speak to you. As you know, smoking is harmful to health. But smokers usually underestimate the harm to health. Pharyngeal cancer is one such harm. Most patients are long-time smokers. They will have tumors grow in their throat, and then they would come to know the relationship between smoking and pharyngeal cancer. Now, I'm one such person. In order to allow the public to know more about this cancer and also to promote cessation for more people, our club supports enlarging the health warning. %85%. And also to include the quit line, so as also to increase the choice of forms of health warnings. Let us make the best use of the space on cigarette packaging to do direct public education. Pharyngeal cancer patients need time and confidence in order to speak again and also to reintegrate into society. Our club helps them. We also hope the government and the council will pass these proposals as soon as possible to protect public health and to save more lives and people's voices. Thank you. Thank you, Mr. Tang. Thank you for coming here to speak directly to us. Mr. Chen Yet-Wah from the Hong Kong Heart and Thoracic Diseases Association. We support the increase of the health warning size. We have been set up for 70 years. We have been working against lung diseases. We have been promoting the prevention of tuberculosis, heart disease, and we have been mounting exhibitions, and we train professionals, and we also conduct seminars. We know there are many chemicals in tobacco, 7,000 of them, including nicotine, tar, and carbon monoxide. And smoking can lead to heart disease, stroke, lung cancers. In 2016, in the 16th World Tobacco and Health Conference, the WHO said that there is an effect done by 100% health warning on packaging. And also in 2016, the 100% health warning coverage was made the theme of the No Smoking Day in 2016. And the WHO asked all countries to get prepared. As the Hong Kong Tuberculosis, Chest and Heart Diseases Association, we are very active in promoting health education. We encourage smokers to quit smoking, and we also help people to stay away from smoking. That is why, as I said, we definitely support legislating to enlarge the health warning to 85%, and also to increase the forms of health warnings to 12, and also to exhibit the quit line so people will know the evils of smoking and so would quit as soon as possible. Next, Mr. Wang Xing-chek from the Po Leung Kok Anti-Smoking Project. As a school sponsoring body, the Po Leung Kok places a lot of emphasis on the physical and psychological development of children. That is why we support these proposals. Apart from tobacco control policies, it is important for us to teach the younger generation. Therefore, starting from 2011, Po Leung Kok and the administration have started kindergarten cigarette or smoking prevention education programs. So we can organize school-based activities in secondary schools and primary schools, and also extended courses in kindergartens. Students will come to know the impact of smoking, so they will build up this anti-smoking attitude. But then we need the efforts of all quarters. Hong Kong's smoking population dropped from 23.3% in 1982 to 10.5% in 2015. This goes to show that the government's efforts over the years has achieved effects. But then if we want to protect young children and also the public from the evils of tobacco and secondary smoke. The tobacco control policies must be updated from time to time. The administration is proposing a new order requiring tobacco companies to enlarge the area of the health warning to 85% and also to increase the form of health warnings. All that can help us redouble our efforts on public education so more people will stay away from the evil of smoking. In the long term, we hope there will be legislation to designate more open air areas as non-smoking areas, and also to regulate electronic cigarettes, which are becoming more popular. We expect tobacco control policies to further protect public health, and we hope the government and society can take this opportunity to join hands to build a smoke-free Hong Kong. Next, Lok Sin Tong Benevolent Society Kowloon Medical Services Department.
The Lok Sin Tong is concerned about public health. Apart from publicity projects, we also provide primary care for the public, including the operation of clinics. We understand the harms of smoking to our society. That's why we support enlarging the graphic warnings to 85% and increasing the number of forms to 12 while incorporating the quit line. Tobacco products impose a heavy burden on our society because of different diseases. In the past, we only had 6 prescribed forms on the packaging, and they didn't fully reflect the harms of smoking. A lot of diseases caused by smoking are not familiar to the public. They might know the name of the diseases, but not the real effects of such diseases. By increasing the number of forms on cigarette packs, we can allow smokers to know about such harms. Through our Chinese and Western medical services, we got in contact with a number of smokers, and during the peak flu season, a lot of coughs were due to weather and smoking. So we realized the health impacts of smoking. The smoking rate is about 10%. Some people might find the work adequate, but as a healthcare provider, the less smokers, the better. With one less smoker, our society can benefit. From our experience in providing health services, graphics can certainly induce behavioral changes. Doctors often use graphics to explain the impacts on health, so enlarging the graphic warnings would certainly help deter smoking. By enlarging graphic warnings, we also want consumers to know the truth. The consumers would not just see words or a PowerPoint presentation, but the actual impacts of health in a graphic manner. We want the public to know about the harms of smoking as well as the associated pains. This way, they would know the downfalls of smoking. So we must pass this amendment on enlarging the graphic warnings. We also hope the government can enlarge the graphic warnings on cigarette packs and review the tobacco policy to build a smoke-free Hong Kong. Mr. Chu Chi-hin from the WISE project. WISE is a self-financed smoking cessation program provided by Lok Sin Tong for women. We know the negative impacts of smoking on women, so I strongly support the amendments to the graphic warnings on cigarette packs. Tobacco products are consumables. Every consumer would want to know the negative consequences of using a specific product and the relevant diseases and risks. Right now, we only have 6 prescribed forms of graphic warnings, so do we only have 6 diseases caused by smoking? Apart from enlarging the graphics to 85%, we must also introduce or increase the number of forms to 12 or beyond. We should also incorporate the quit line. These graphics would tell the truth or show the truth to smokers, and they would better understand the harms of smoking as well as the potential risks. So this is helpful to the society and families. This would also discourage non-smokers from buying their first cigarettes because of attractive packaging. The tobacco companies and the government should both offer ample information to consumers so that they know about the harms of smoking. Tobacco companies should use graphics to show smokers the serious consequences of smoking. A lot of deputations said that graphic warnings would not deter smokers from buying cigarettes. All products targeting women spend a lot of money every year on product design and packaging. For consumers, tobacco packaging is an important point of consideration. So by enlarging the graphic warnings, we can remind female smokers of the harms of smoking and encourage them to quit. I like to recall my childhood memories. When I was small, I saw a lot of advertisements from tobacco companies. There were a lot of beautiful girls, sexy cars, and if the advertisements could not affect consumer behavior, why would tobacco companies take out a lot of advertisements? Ms. Robin Kwan, smoking is harmful to health, and the tar, nicotine, and carbon monoxide will cause serious damage, including cancers, pulmonary diseases, etc. Secondhand smoke would increase the risk of lung cancer, heart diseases, and respiratory diseases, and pregnant smokers would also see bad health to their fetuses. With the tobacco controls from the government, the smoking population has constantly dropped. Recently, the government passed the Smoking Public Health Notices Amendment Order 2017 to increase or enlarge the graphic warnings to 85% and increase the number of forms and incorporating the quit line. I think expanding the graphic warning would deter the public from smoking, especially young people, and the quit line can offer useful information for those who want to quit and offer them support. Smoking is a habit, and it's hard to quit when it has become part of life. While learning about the harms of smoking, we should try to foster a healthy environment for our young people so that our young people would stay away from cigarettes. When I was small, my father quit smoking, and he set a great example for his children. Now he's more than 80 and still going strong. Thank you very much. From Philip Morris Asia Limited, Mr. Kiripong.
The opportunity to present our views on this important matter. My name is Kiripong Jangkamonkunchai and I represent Philip Morris Asia Limited. Hong Kong has one of the lowest smoking rates in the world, last recorded at 10.5% in 2015. The number of cigarette smokers in Hong Kong has remained relatively stagnant at approximately 650,000. Despite the implementation of several tobacco control regulations. Like you, we fully recognize that smoking cigarettes is harmful, and that tobacco control measure should be in place to effectively reduce the harm caused by smoking. However, given the situation in Hong Kong, it may be questionable whether the traditional approach to tobacco control will continue to yield results. Therefore, we believe it would be a good policy for the government to also recognize that technology exists today that provides non-combustible alternatives to smoking that are scientifically proven to be significantly less harmful than cigarette smoking. Many governments that have allowed consumers access to non-combustible alternatives have seen dramatic reductions in smoking rates over a short period of time. Just one example, public health authorities in the UK have recognized that e-cigarettes are significantly safer than cigarettes, and more than 1.5 million smokers have already switched. E-cigarettes, however, are not the only form of non-combustible alternatives. Various manufacturers have invested in the development of tobacco products that do not burn tobacco. Since 2015, our heated tobacco product, IQOS, has been made available in more than 20 countries. The development of this product follows a rigorous scientific assessment program, and the results to date indicate that IQOS vapor has 90 to 95% less harmful constituents compared to smoke from cigarettes, and the health impact on smokers who switch to IQOS approaches that of smokers who quit. The product is also proven to appeal principally to adult smokers, whilst raising very low interest among non-smokers. Additionally, early commercial results have indicated that in less than 2 years, more than 2 million adult smokers stopped using cigarettes and completely switched to IQOS. At Philip Morris, our ambition is to lead a full-scale effort to ensure that non-combustible products ultimately replace cigarettes to the benefit of adult smokers and society. We believe that these technological innovations have the real ability to complement the current tobacco control measure. We encourage the government to review the developing scientific evidence about the health and technology breakthroughs that we are achieving with non-combustible products that have the real potential to reduce the risk of smoking here in Hong Kong. Thank you, Mr. Chairman.
好，唔該晒。下一位呢
Next, from the Smoke-Free Care Alliance, Mr. Wong Kim-Fai. Thank you. We support enlarging the graphic warnings on cigarette packs. We try to solicit support on our smoke-free campaign. I'm a social worker responsible for smoking cessation. I want to tell smokers and the public that most smokers are split over whether to quit. The more smoking cessation measures in place, they would have more options to quit. This is about a balance. On one side, people want to quit. On the other, people don't. There are many reasons to quit for themselves, for their families, or for money, and they are in a constant struggle. So in terms of the measures, we have to give them a hand. The biggest beneficiaries would be our elderly people. Very often, they don't have very good eyes, and the current cigarette packs might not be very clear for them. They might not be able to see the health messages. By enlarging the graphic warnings, senior smokers will certainly benefit, because modern medicine tells us that older smokers are in urgent need to quit, and they should try to improve their health. So this is final chance for them. For older smokers or relatively uneducated smokers, we also found some information online. Some tobacco companies said new designs would lead to challenges in design. In Thailand, this is how their cigarette packs look like. They have beautiful labels, and the size requirement is 85% in Thailand, so I don't see any issues here. I want to offer a new perspective. In response to the World Smoke-Free Day, we recruited volunteers all around Hong Kong, and we picked up nearly 7,000 cigarette butts all around Hong Kong. these are not ordinary trash. They translate to second or third hand smoke, especially burning cigarette butts. So in a crowded city, we should not have tobacco. By enlarging the graphics to 85%, this is only the first step. Hong Kong needs to become a totally smoke-free city. Thank you very much. Next, Hong Kong United Against Illicit Trade. Mr. Jeffrey Owen Herbert.
Opportunity to present our views. Hong Kong UAT opposes the increase in health warning size. It is crucial we fight illicit cigarette trade in the first instance. Today, despite the good efforts of the Customs and Excise Department in Hong Kong, the illicit trade of cigarettes in Hong Kong remains a problem. Our figures for 2015 show illicit cigarettes accounted for 1 in 3 cigarettes consumed in Hong Kong, costing the government approximately 2.9 billion in direct tax revenue loss, without the cost of enforcement and court cases in support. Accordingly, Hong Kong United Against Illicit Trade stands firmly behind measures which fight illicit cigarettes and voices concerns against regulations which help illicit tobacco trade in Hong Kong. The Smoking Public Health Notices Amendment Order 2017 to increase the size of government health warnings on tobacco packs is of great concern, because we do foresee the direct effect it will have on the illicit tobacco trade, and it indirectly paves the way for increased criminal activities. I submit 3 points. International experience has shown that when a country continues to place regulatory burdens on the legal tobacco trade, such as Hong Kong, where there is a flourishing illegal market, consumers are motivated to purchase illegal products. You have heard others cite the success of Australia with its plain packaging. In the first year of plain packaging, illegal consumption in cigarettes rose by 17%, the biggest ever in Australia's history. Australia is now awash with contraband, counterfeit, unbranded tobacco, and also domestically grown illicit tobacco. This is a country with no land borders, unlike Hong Kong. Excessive government health warnings are likely to result in increased consumer demand for tobacco products with no or minimum health warnings. This demand would create an increase in availability of illicit products as smugglers and counterfeiters try to capitalise on the growth in consumer demand. Illicit trade is likely to worsen if extreme measures such as excessive graphic health warnings restrict space for security and authentication features, and with increased ease of counterfeiting as a result. I summarise, in the interest of public health, Hong Kong United recognises the need to periodically review and revise tobacco control regulations. However, we stand firm in our belief that effective tobacco control regulations must be based on a comprehensive evidence that it can achieve the intended public health objectives whilst not triggering unintended consequences. To strike a more balanced approach between protecting public health and potentially exacerbating the illicit trade situation in Hong Kong, Hong Kong United submits that the Subcommittee should consider the guidelines on health warnings under the European Union Tobacco Productive Directive. Thank you very much, Mr. Chairman.
Thank you. 好，咁就多。
Thank you very much. I'd like to thank all the deputations. I'd like to hand over to the administration before I open up the floor for questions. Dr. Pt2. So perhaps we'll hand over to the Under-Secretary. I'd like to thank the deputations once again for sharing your views. In this session, a lot of deputations talked about the impacts of smoking on youth and how enlarging the graphic warnings can help our young people. And we also heard from parents, teachers, or parent-teacher associations, as well as youth workers. They have shared their own experience. We accept those views, we acknowledge those views, and in terms of graphic warnings, Hong Kong is lagging behind other countries. And in 2007, we did the first survey, the figure was 50, well, the requirement was 50%. It wasn't expanded since then. And we hope to enlarge the warnings because this would benefit public health. We need to know the local situation, and we are also keeping tabs on local trends. Hopefully, we can further refine Hong Kong's tobacco control policy. We have been talking about graphic health warnings. If we don't do anything, they might serve as a form of advertisement and appeal to young people, as we have said many times. The health warnings would educate the public on the risks of smoking as well as its harms.
So we need to convey health information. We need some deterrent images, and we also need real evidence, some clinical evidence indicating that smoking can lead to certain consequences, and all of this will be displayed in our graphic health warning. So when the government implements this measure, in the past the health department, they adopted a multi-pronged approach, and this was one means. We are not just paying lip service. So this is part of our multi-pronged approach and step-by-step approach. So just now, some deputations, and we also had heard from smokers, share their experience with us. We know that some people feel the graphic health warning might not have an impact on quitting, but those who support us, we have people who help people quit smoking. They told us that it does have a deterrent effect, that it discourages people from smoking. We've heard the different opinions, but given our multi-pronged approach, this is just part of the equation. We do have other smoking control measures that are underway, and we have to thank you for urging us to do more and to take a more vigorous approach. So we rely on legislation, public education, we work on tax. So we hope that to bring down the number of smokers in Hong Kong, and we also wish to fine-tune our public health policy. We want to do a better job in our smoking control work. One deputation member mentioned that our graphic health warning, the images that we display are factual images. So this illustrates that when we design the graphic health warning, it is evidence-based, and the health warnings do help people quit smoking. And well, even if it doesn't achieve that goal in one step, it will at least prompt people to consider quitting, or it might prompt people to change behavior. So in the whole quitting process, this is an important first step, and we need to help everybody quit smoking. Well, regarding our work on quitting smoking, we've heard that some people want us to do more, and I can tell you in the past 5 years or 10 years, our commitment to quitting smoking. We've been spending more and more resources. We will be spending more resources with smokers, help them to quit and help them lead a healthier lifestyle. So let's open up the floor to legislators. Mr. Dr. Chan Pui-yin. Well, I have heard a lot of the public's views, and I'd like those in favor and those against the proposal, I would like them to hear the public views. As a doctor, I support smoking control measures, but we heard people say that there's no evidence, no science, no statistics. It leads to more counterfeit or fake or smuggling cigarettes. So I would like to ask Professor Lam. A lot of times we talk about abstract scientific principles that maybe it's over people's heads. So Professor Lam, could you tell us if you say there's no scientific evidence for increasing the graphic health warning, so could you spend 2-3 minutes and tell us, how do you explain this to people? Thank you. First of all, the whole world, including Hong Kong, there has been a lot of research, a lot of statistics, including studies with smokers. So smokers are aware that it's dangerous to health, but they just don't know to what extent, the extent of the harm. For example, if I told you there's a melamine in a formula, would you consume infant formula? Will you give it to your kids? If you know that melamine is very dangerous, and I want to emphasize again, the toxins, the chemical byproducts, the carcinogens, it's more than 1,000 times as toxic than melamine. But you let your kids smoke secondhand smoke. It just shows you how addicted they are to cigarettes. So when the smokers are healthy, don't you think they're worried about their health? They might have some doubts about their health, but they're just in denial. They are, when they go see the doctor, if they cough, they would think they have cancer. If we heard from our speaker from the New Voice Club, we have people laying in hospital. They know that if they didn't smoke, they wouldn't be in hospital. Even the family knows that if they quit smoking earlier, the smoker wouldn't have to die. So in conclusion, 1 out of 2 deaths is very conservative in medical science. Aside from real patients and non-smokers being affected, and a lot of statistics, including lab data, why would we be talking about this? Why is WHO dealing with this? We do have also an international tobacco control framework. It says that we need to do a comprehensive job regarding smoking control. Some people say that we don't understand smoking patients. We have interviewed tens of thousands of smoking patients. At this point, they don't want to quit. We know why they don't want to quit. It's because they're addicted. Or perhaps they feel the benefits outweigh the disadvantages. Doesn't matter. They are in denial. That's fine. We just tell them we're not going to give up. So as medical professionals, even the government, we won't give up on these people. Some people say it doesn't matter. People in Hong Kong have a long life anyway. Well, but we're in public health. We know that 1 death is too much. In the past, we helped people quit. We also have successful people who are successful in quitting. Just now we heard a person talk about Japan, but Japan's males have poor health. They are worse than Hong Kong men, and even the Japanese women, their health, their women's health is worse than Hong Kong women's health because they have more female smokers. Well, does that mean that we need to ban smoking or ban tobacco? Well, I support that. If we could bring the smoking population from 10% down to 5%, that would be an opportunity for a total ban on smoking. And in fact, some countries are progressing towards that goal. Next, Mr. Leung Go-hong. Well, Chairman, I didn't hear the statistics. Dr. Chan Puyin's question wasn't answered, but it doesn't matter. First of all, I'd like to ask the government. I've asked you many times. When you collect the tax or the levy on tobacco, where do you spend the money? Is it spent on helping people quit? If not, what you were proposing just now is just fake sincerity. You should spend all the tobacco levy on and let's say you increase the graphic warning size from 70% to 85%. Well, we heard about talk on economics and the marginal rate of return. Well, I'm not going to argue about that. I smoke. I have no objection to you, but if you want to use that line of reasoning, then why do we encourage people to share alcohol? Why do people drink all night? And why does the government toast? We're talking about liver cancer, kidney cancer. Why do they? Why aren't they vegetarian? When the government hosts feasts, why don't they ban trans fats? So, well, I'm not encouraging smoking, and I'm also not saying that I'll object to 85%. I just think this is a false sincerity. We have anti-smoking movements. And between the two camps, a lot of resources are being used. Now, if you're really concerned about public health, well, if we have people dying from secondhand smoke, but what about when people share a bottle? We have one person buying a bottle and then shares it with 5 buddies. Will you ban alcohol? Will you ban alcohol commercials? Do you say that when you toast people that people will die from it? No, you don't. Do you tell people to bottoms up? Well, we have 2 doctors here. Well, if you are really concerned about everybody's health, will you propose having a health warning for alcohol? What about trans fats? And what about too much sugar? Will you tell the public if the air pollution index is over a certain level, will you tell people to avoid the streets? So, Chairman, I know Mr. Chi. Those people who object to smoking, they are correct. You don't want them people to smoke. Well, when you take the point to the extreme, you are insulting our intelligence because you are neglecting other negative items. Well, Chairman, I need to disclose I'm a smoker. I agree that people shouldn't smoke, but I think the anti-smoking campaign has been taken to an extreme. The government is spending resources the to support people who are against smoking, and then we have people. You have the tobacco industry on the other hand. So we're spending time and money on things. What about the shortage of medical facilities in Hong Kong? Well, I have 4 minutes, and I'd like to dedicate that time to Professor Lam, because just now Dr. Tan Puyin asked, they have been asking for statistics. I think they need some statistics, whether they are the tobacco lobbyists or anti-smoking lobbyists. They want to hear the efficacy of the graphic health warning, and does Professor Lam have statistics on that? And second, I'd like the Undersecretary to answer. Mr. Leung Kwok-hong was saying that tobacco levy, how much does the government collect, and how much money is spent on costs? I agree that if the government has not done a good job and just relied on graphic health warning, it would give people the impression that the government is irresponsible. So, Professor Lam, do you have any statistics? Chairman, we have two types of statistics. One is when a policy is implemented, we have statistics, but Hong Kong hasn't implemented that. Now, if you look at areas where they implemented 100% graphic warning, a lot of people mentioned that there is already a lot of information indicating that it's effective. Well, we're not saying 100% effective. Even if it's 1% effective and help 1% people quit, it's worth it. So before implementation of 100% graphic warning, we have to ask, do the public support that? If you give these images to young people, just now we heard the latest in-depth survey to kids, and they tell us clearly that 85% graphic health warning is definitely more effective than 50%. Undersecretary, could you respond? How much tax levy do we receive, and how much is spent on smoking control, and how much is spent on helping people, the public, quit smoking? Thank you, Chairman. If you're talking about tobacco levy mechanism, tobacco tax levy, the tax levy goes to the Treasury, and the Hospital Authority, FEHD, and Health Department are funded by the government. So the government funds them, and the tax is not used totally on smoking control, but smoking control, first of all, it's multi-pronged and it's a step-by-step approach, and third, we do use effective measures. For example, in the health department, the smoking control office, their funding is 170 million. That was last year's resources. But the money spent does not reflect our total effort, because in the Hospital Authority we have a lot of smoking clinics, we have a lot of staff helping people to quit smoking. We also have medication paid by the Hospital Authority, and diseases arising from smoking, and its burden on the medical system. That's also another set of figures. Well, Undersecretary, you haven't answered. I think it's more than 6 billion. How much is actually spent on quitting smoking? That's important. As an example, of course I support the government, but if you don't have statistics, you're falling short of expectations. Professor Lee can Dr. Lee can elaborate. Let me elaborate on the resources. Every year we have 170 million for the Smoking Control Office, and 60 million is for quitting services. We subsidize NGOs, voluntary associations. We also have resources, some 20 million for COSH, and they do promotional work and education work. As the Undersecretary said, a lot of resources are spent in hospital authority. They have quitting clinics. We also have to spend money on patients who have diseases related to smoking. In 2011, our latest figures indicate that deaths arising from smoking are some 7,000 per year, and $5.5 billion are involved, and the majority of the money is spent in hospital authority to deal with diseases arising from smoking. So a lot of resources are spent on prevention and quitting smoking, and a lot of money is also spent on patients with diseases arising from smoking. Dr. Chan, in the last session I asked the government, how do they tackle smuggled cigarettes?
Just now, somebody also mentioned this, so I'll ask again because you did not give me a satisfactory answer. Now is your second chance. For the Hong Kong public and the industry, both are very worried about illicit cigarettes. What has the administration done to protect the industry and the public? What have you done? Can you show me some evidence or statistics, please? Who will take the question? Undersecretary. I will defer to my colleague, but before we go to figures, I'd like to reiterate that this measure to enlarge the health warning will not increase the number of illicit trading of cigarettes. There has not been evidence of this type throughout the world, and in fact the customs has been cracking down on illicit cigarettes. Can I ask the DS to give you the answer? Well, if you seek figures, we can say that in 2007 we seized over 100 million illicit cigarette sticks, and in 2016 it is about 63 million sticks, and the figure has dropped. It seems we did not give you a clear answer. It is because people said that since you are seizing fewer illicit cigarette sticks, does it mean that the customs has not been working hard? But let us look at the number of cases. There has been no obvious drop. In 2007, 7,453 cases. By 2016, there were 8,326 cases. And a few years ago, it was about 10,000 cases every year. Therefore, you can see that the customs has not slackened in cracking down on illicit trade. But then we can't see the situation worsening either. And apart from cracking down the trade at source, they also have dedicated teams to enforce the law. They are of the view that the situation is under control. I can also add that even if our smoking rate is going down, we can see that duty-paid cigarettes have not decreased. So we can't say that illicit trade has worsened. We still have some time. Dr. Chan, I don't have any follow-up. Second round, Leung Kwok Hong. I can tell you something more scientific. Get 2,000 smokers and do a survey. Well, you can go for 5,000, 10,000, and then ask them whether they use duty-paid or illicit cigarettes, and then you will know what is happening. You can do that. As long as the sample is big enough, you can do your projection. Even for Hong Kong-Zhuhai-Macau Bridge, you used projections to build it. With that projection, you will know how much of the smoking done is based on illicit cigarettes. And secondly, because you demonize smokers, it's like religious persecution. Well, it's like asking how many people not using the dominant religion in a certain country. You said you received $6 billion and 100 million has been spent on tobacco control, and then 5.5 billion was used for saving smokers. In other words, you have about 200 million in your pockets, so smokers are not using your medical services. In other words, medical costs have not climbed because of smoking, because you have received the same amount in duty on tobacco. This is the same as drug takers. Once you demonize them, they are not going to tell you the truth, and they don't want to come out. They will not admit that they are smokers. And if you ask them whether they use duty-paid or illicit cigarettes, again, they will not tell you. If you demonize something, you will not know the real situation, because people won't tell you. Understand? On the mainland, everybody supports the party. On the mainland, if people ask you whether you object to one-party autocracy, you can even have a sample of 200,000. Or you can ask people whether you support one-party autocracy. People will not say they object because they will die. Anyone who has studied any amount of books will know that if you demonize something, you will not solve the problem. Professor Lam, you agree with me, right? Remember this. Once we have political correctness, well, I can teach you this social science lesson one day. There will be people who are politically incorrect, will be oppressed. Go to Brussels. Many people do that in the EU. And the Hong Kong government is following that example. I am a councillor. Donald Tsang worked on this for 4 years. And he forgot about other more important issues. We don't have dentists, we don't have doctors, we don't have nurses, we don't have hardware. Look, please wake up. Allow the smokers to die. They are voluntary. Just tell them not to smoke. Why demonize them? There are other more important issues. In 2004, I was already a councillor. He did not build public hospitals. And then you accepted mainland pregnant women to come to Hong Kong. Well, never mind. The list goes on. I just like to allow the officials to give further replies. I remember the British American Tobacco Company said that it is possible that this is in contrast to Basic Law Article 6 and 105. I'd like to ask the administration, have you considered that point? Because if that is the case, I am worried. It's not that I don't support you. This is the first question. Secondly, I will give 1 minute to the British American company to respond to what the administration said. But first, the Undersecretary. Can you comment on Article 6 and 105 of the Basic Law? Can I defer to the DS? Yes, we have looked at that. DS. With regard to the trademark, well, the concern is for tobacco products to carry the trademark. Basically, under the trademarks ordinance and also under the common law, as long as there is no infringement, meaning that there is no faking of the trademark, making people confused about the trademark. But it doesn't mean that there is no control under other laws. Talking about the health warnings proposed this time, we say it should cover 85% on the largest surfaces. But in fact, you also still have 15% and also the other surfaces for the trade to print the trademark. Sometimes the trademark might have to be adjusted, but if you can keep its obvious characteristics, well, we have already consulted the legal sector, and this will not be in contravention of the basic law. Even if there has to be adjustment, if the trademark is franchised, the property rights have not been deprived, so there is no contravention of the basic law. Thank you. British American Tobacco Company, is it that you would like to respond? You have 1 minute.
Thank you, Mr. Chairman. Can I just say at the outset, British American Tobacco knows and doesn't challenge or object to the fact that smoking is harmful. We're well aware of that. I think in addition to the points that I've already made, we're very concerned from a particularly a legal perspective as to whether or not this is correct or the proper approach to be taken in relation to the amendment order. The other point is that we are focused on understanding the extent of what objective evidence there is that supports the efficacy of 85%. So I have 3 questions in relation to all of that. So the first is then, what is the objective evidence that the government has relied on to say that it's 85%, which will be effective in reducing smoking prevalence? What's the survey? Where's the data so that we can understand it, understand the reliability, understand what representations have been made in relation to that data? The second is, has the government actually conducted a regulatory impact assessment or produced any kind of a quality report or any assessment into anti-illicit trade? We understand these things were done in the UK. Have they been done here? If so, what's the outcome of that? And then finally, BAT would really like to know why it has not received a substantive response from the government to its lengthy and detailed written submissions over the last 2 years. We've received 1 letter from you. It's a 2-page letter. It's not really a response at all. As you'll remember from previous meetings, LegCo members have also asked why these important issues haven't been addressed in writing. Thank you very much.
OK， 好，咁有半分鐘可以回應。
Okay, half a minute for the Undersecretary. Thank you, Chairman. We also thank the BAT representative. Number one, we said many times that in Canada, Australia, they have done research showing that enlarging the health warning can lower the smoking rate. In our previous papers, we already detailed this. Secondly, our response. In our previous papers, and also at previous panel meetings, and also in previous meetings, we already responded to the questions and challenges of tobacco companies. We believe we have already responded appropriately. All right. Time is almost up. We should end our meeting at 7:55. And we have already overrun. We thank all the deputations, 91 of them. We will continue to scrutinize the order. On Friday at 8:30, we are going to hold our meeting again. And I will remind you that if you would like the subcommittee to consider new amendments, please submit them as soon as possible. We have already received a proposed CSA committee stage amendment from Mr. Junior's whole member. So take a look, and if other members would like to propose new amendments, please submit them as soon as possible, because by early June we have to give a report to the Council. Thank you very much, deputations and individuals. We'll continue to encourage Hong Kong people to live healthily. Thank you.